Hey guys, it's Karen, and I am back with a very special guest. Dr. Charlotte is here with us today, and we are going to be talking a little bit about pelvic floor health. And this is something that I mention quite frequently, but I do always express that I'm not an expert in it. And so why not bring an expert to us to tell a little bit more of why pelvic floor health is so important and why we're hearing more of it, especially as we're getting older. So let me first kind of let you introduce yourself, tell us a little bit about you, and then we'll jump into it.
Yeah, my name is Dr. Charlotte Singletary. I started my career as an athletic trainer. Last 17 years, I've been practicing as a physical therapist, specializing in pelvic floor rehabilitation for both men and women. I'm also a mom of three with my fair share of pelvic health issues that are mostly resolved now. And then as I entered into my 40s, I started looking more and more seriously into menopause because I still have this mental image of my mom. I think she started early. She was just in her 40s of her running to the freezer and, sticking her head in the freezer.
Yes.
So hot. So I'm like, that's not where I want to go with this. So just doing my research, I came across your page and I really liked your information. So I followed you and liked your stuff, and you made a connection with me. And I enjoy, this connection and hitting it off and hoping for a great partnership here, because I definitely got a lot to share about pelvic floor health.
Well, and that's the thing. And so when we got to chatting before we met up and kind of looked at what the other person does, I never really was told anything about pelvic floor health. And one of the questions you asked me was, okay, you've had 3 kids. Did they ever say anything when you were in the hospital? Not once. And I recognized I had a C-section, and maybe if I had a vaginal delivery, it would have been a different conversation, but that was never addressed. And I can tell you, growing up in the 80s and the 90s, I read a lot of Cosmo, and I do remember always seeing articles about Kegels, but I never understood why those were important. As reading the magazine, I just figured it was going to enhance my sexual pleasure. I didn't realize that there was an actual need for it for my physical health. So it's only been the past couple of years that I've really gotten into menopause, had conversations with my girlfriends. As a personal trainer, women are doing jumping jacks and they're like, I can't do anymore. And I'm thinking, what's going on? How can I help you, make this more comfortable? So I guess the first question is, what is pelvic floor and why is it important?
So your pelvic floor is a group of soft tissue made up of muscles, ligaments, tendons, nerve tissue as well, that sit on the bottom of your pelvic rim. So connects from your pubic bone all the way to your tailbone and around. And one of its primary functions is to support the organs within it, but also to keep you continent. And there's others too that we could talk about another time. Most people imagine it as a hammock sitting underneath your pelvic structure, but I like to think of it more like water under a boat. That gives you more of an image of it being dynamic and reactive to the environment.
Okay.
So there's age-related changes that happens to your pelvic floor with the muscles itself and the soft tissue, and also hormonal changes. So when you get into menopause, the decrease in estrogen has a dynamic and really severe reaction to your soft tissues. So like I said, it's really important because once you get into those age-related changes and the decrease in estrogen, you start developing issues like pelvic organ prolapse and urinary incontinence. Some of the age-related changes that happens with the muscle itself, not even looking hormonally, is that muscle over time, you start to lose it.
Right.
You get bigger, but there's also fibrotic changes. So your muscles actually get stiffer, less flexible, more rigid. So it becomes less functional, weaker, and the ability for that muscle to hold up your organs or to bear load, to stretch and to move with you becomes less and less over time. So it leads to issues like incontinence. And with a decrease in estrogen itself, estrogen acts like a vasodilator. So what that means is that it promotes blood flow to your area. So over time, as you decrease estrogen, all your blood flow restriction, everything starts to get restricted. So there's less blood flow entering the vulvar area, the vaginal walls. Everything starts to get flatter, thinner. Your membranes start to get really thin. So vaginal penetration, intercourse, insertion of tampons, or, during a pap smear, everything gets to be really uncomfortable as you enter, because the tissues are just weaker and thinner. So they're more susceptible to tearing and breaking. And
Okay.
that gets
Okay.
painful.
And I have to tell you, I've had some very open, real conversations with women. Obviously, one, we talk about incontinence and, sneezing or laughing or jumping. And I can tell you, I remember, I can't tell you a time that my mother didn't use female products year round. And I just assumed that's what you did. And I just assumed that that's how we had to live. And then it never happened to me. So I was like, well, I don't understand why my mother is dealing with this and I'm not dealing with it. So, and the other thing I was going to say with regard to those open, honest conversations is I have a lot of women that are very honest about how painful sex has become. And it almost feels like there's little, almost paper cuts around the area, making it very, obviously very uncomfortable. And I've shared this story 100 times. I'm sure my husband hates that I share it. But at one point, when I was struggling with those changes in my body and the changes of the estrogen and what was going on down there, I was like, do I have an STD? Like, how would I have an STD? Is my husband not faithful to me? Like, what's going on? Women should never feel that way. Women should never question. And thank God we have an open and honest relationship. And I told him about it. He was like, it's not me. So I was able to talk to my doctor about this, and she explained that that's all part of what's going on with, part of your pelvic floor changes and the estrogen changes. So you probably hear a lot of this.
Yeah, if you think about, the thinning of your tissues and the weakening of your tissues, I mean, basically every time you enter the vagina, stretch, touch, you're creating micro trauma. So that's where that paper cut feeling comes from.
Okay.
Because the tissues aren't flexible anymore. So, with vaginal penetration, with that flexibility and lubrication, it moves freely. But with decreased blood flow, everything gets tighter, thinner. You're almost tearing as you stretch.
Yeah.
And that's where the pain comes from. And plus, it's highly innervated. You've got a lot of free nerve endings down there. So you're very sensitive to any type of touch. So people say even just wiping themselves in the bathroom or bathing themselves down there gets to be really uncomfortable too, more than just sexual intercourse. So with estrogen and low estrogen, it has an effect on the smooth muscles around your ureter, or the tube where your pee comes out. So as that starts to weaken, then, and the base of your bladder also, all those tissues get to be thin. So if you think of everything just falling, and there's nothing holding back the bladder and the urine from coming out of the ureters, that's where the incontinence comes from too.
Okay.
And we tend to be less active as we get older as well. So those muscles get used less and your pelvic floor muscles get weaker, and gravity has its effect of pulling everything down. So you've got all these things happening at the same time, which is not in your favor.
Right.
So that's where, getting up from a chair or laughing, sneezing, coughing, there's not enough strength or force to hold everything up. And it's just easy for everything to fall back down.
Yeah.
So that's where, talking with your physician to get onto those estrogen therapies to help promote more estrogen in the area, to, if you want to imagine it, plumping up your tissues.
That's what I was going to say.
With, a personal trainer or physical therapist, if there's already a diagnosis, to address your muscle function. And as far as PT diagnoses, we look at strength, tightness, flexibility, endurance, what can your muscles do? What isn't it doing? And then address it from there.
So a lot of women assume that the weakness comes from having children. But I've got clients that have never had children and are starting to experience this. So it really is not just a baby issue.
So there's a lot of genetics at play.
Okay.
So, if we compare you and me, maybe you've just got the genetics where you heal better and you've got better collagen output to create a better structure.
Right.
Also, if you look at a lifetime, because pelvic care starts at childhood, what was your nutrition like? How active were you? It doesn't matter if you're an athlete or not, because some athletes are highly active and maybe underweight. So their estrogen's already low at the start of their, development.
Yeah.
So they're already kind of at risk for developing all these issues later. So, good genetics, good nutrition, exercise, the sooner you start all that, you're creating a functional reserve. So when you get, to our age, hopefully you've got enough of that to carry you through pregnancy and childbirth. The ladies that have never been pregnant or never developed or carried a child to term, whether it's through C-section or vaginal delivery, those ladies that are what we call nulliparous, they might have developed other issues. Maybe it's the genetics again. Maybe they were these highly functioning athletes. Or maybe even, they've had radiation or chemotherapies that affected their ovaries. There's all kinds of reasons why. Diabetes, obesity could affect your ability to create estrogen and to repair and rebuild your muscles too. So the more, I don't want to just say trauma, but the more factors that are in place that create this domino effect with you, whether you have a baby or not, really increases or decreases your chances for incontinence or organ prolapse, or, there's a whole list of other things that happen too with pelvic floor dysfunction.
So it is important that all women are understanding that this is something that is going to, that could possibly affect you. It doesn't, it's all, whole life experience.
It's going to happen eventually.
So, at this point in my age, if I haven't done anything in the past to strengthen my pelvic floor or focus on my pelvic floor health, is it too late for me?
It is never too late. I mean, you've seen these stories of, these 67-year-old little ladies that's never exercised in their life, and all of a sudden they're like bodybuilders, professional builders.
Yeah. Oh my gosh.
They go back into the gym. You could build muscle any point of your life. You just need to make sure that you've got that lifestyle that supports muscle growth and you're eating the right foods. The biggest problem for elderly women is our diets. We just don't eat enough protein like we should. So if you don't have the building blocks, plus, you've lacked estrogen to help you build that collagen and create those building blocks for you, you're not going to build muscle. I mean, you could build strength, but you're not actually going to build the girth or the cross-sectional areas, what we call it, of muscle to make a big difference. But yeah, you could start fitness training and strength building any point in your life.
That's a really good point, because I do know as you get older, obviously your appetite changes. You're not as hungry very often. I saw that with my grandmother as she was getting older. She just wasn't eating very much. And what she was eating wasn't really focused on, building this healthy lifestyle or, prioritizing protein for that muscle strength and muscle building and recovery. So that's important to understand. Okay, so I can still make changes as I'm getting older, and beyond Cosmo's recommended Kegels, what are some other things that I can do just starting out, plus probably going and seeing somebody and talking to an expert, a doctor or physical therapist? But what are some things that I can do at home to start off?
Okay. Well, first, are you doing Kegels, and are you still experiencing your symptoms, incontinence, pain, etc.? Because sometimes Kegels could actually make things worse.
Okay.
If you've already got a muscle that's hypertonic or overactive because you've been, holding it all day, or you've got maybe scar tissue down there that you've never addressed, everything's already tight. And you're doing Kegels on top of that and making things tighter, it'll just make your symptoms worse.
Okay.
So first determine, what are you doing? Is it effective? If it's not, what can you change? I've even had women come into my clinic and I would say, go ahead and show me what a Kegel is, if that's what you've been doing. And physical therapists, especially if they're trained in pelvic floor therapy, I mean, we could get in there and do vaginal insertion and check directly, or we could just visually see and even take a mirror and show you. Because what's supposed to happen is if you look down at yourself and you do a Kegel, the tissues come up and in towards you. So sometimes I'll tell women, okay, do a Kegel, and they would actually bear down and push out. And they think they're squeezing and pulling in. So you want to make sure that you're actually even doing a Kegel correctly, or sometimes your body and mind isn't connected. And you just completely do the opposite of what you believe you're doing. So once you figure, okay, what I'm doing is not working, maybe find a therapist or someone or a doctor to check to see, well, are you even doing it correctly? And if not, why? Is it tight? Is it just you know, if there was a vaginal delivery or maybe a big baby that you're carrying to term, you know, do you have nerve damage? There's all kinds of things that could happen there. So a PT could go down there and address, you know, what are some of the things that's affecting your ability to do a Kegel correctly? Or are you already hypertonic and you just don't know how to relax? So I love yoga for this. Learning to breathe correctly, breathe down into your pelvic floor without bearing down into your pelvic floor to make things worse. So there's all kinds of things that you could Google online. There's great resources out there to show you things as far as breathing techniques to kind of help relax and calm and to really connect your mind and body to your pelvic floor. You know, a sad story is I've had, well, many sad stories of women coming into clinic would never even touch themselves down there. So they don't even know what it might feel like, what normal sensation is, you know, what it is to feel of a pelvic floor contracting versus relaxing. They just don't want anything to do with it down there. So a lot of times I'll just start with a mirror. And if you could just look at it and create that connection, you know, sometimes that helps as well.
Well, and I think that was one of the things I was going to say as you were talking about it. I can envision women being like, either not comfortable with their doctor, not comfortable with, you know, depending on how they've grown up, if that's something that has never been talked about, if they don't talk about their vagina, if they don't know what it looks like or what it feels like, or haven't self-explored, that's very challenging to even get started. But once women do get started, once they get past that hurdle, and I'm sure that hurdle is bigger, you know, for some women versus other women that feel a little bit more comfortable with their body. Once they get past that, how good can they feel? Like, what are some positive things that they're going to walk away that they're going to notice?
So immediately, and there's different levels depending on how severe your symptoms are, what degree of strength or your tissues are in. But you could gain complete continence. So no leak. Continence is just, you know, even if it's just one or two dribbles doing some sort of activity, that's incontinence. So I think that the numbers is 1 in 3 of us women experience incontinence. Many of us just accept that it's normal.
Right.
Kind of brush it off. Organ prolapse too. I've seen grade 3s reduce themselves into grade 2s, and grade 2s just reduce completely. But that's not the case for everybody. You might need surgical intervention or pessaries. And even like pain wise, I've had women come into the clinic because of vaginismus or a tight pelvic floor that they can't even have sex comfortably because any type of penetration. I mean, even when you get a sore neck and you touch that muscle, it could get really painful. Think of your pelvic floor muscles doing the same. So when touching that, it just makes you jump off the table. But we've worked with women in that condition, reduce their pelvic floor tightness and enjoy pain-free sex for the first time, even for some of them, because they've, like I said, just depending on their history, you know, their trauma, or they're virgins and they're just this issues with just even being comfortable with their bodies with other people around.
Well,
so
and I think this is a lot. I tell people this with regard to health and fitness is we get so used to living uncomfortably with chronic back pain or neck pain or knee pain or just chronic bloating and gut issues. They just accept it. And when they finally get to the point where somebody has stepped in and helps them feel better, they're like, I cannot believe I can feel this way because I have felt like shit for so long. And for women to be able to have good sex finally is so important.
Yeah. Well, I think it starts with conversations like this, because I've had friends, you know, when they realize, oh, you're a pelvic floor physical therapist, what do you do? Oh, you treat that? And they just never felt comfortable talking about these things with anybody because they accept it as normal and it's just part of the thing. Maybe they've seen or heard their moms giggle and laugh about it. And just seeing them, like you said, they just wear their pads and they just go on with life because their moms didn't know either. So I think we're in a great spot to even share with our daughters and friends and neighbors to say, hey, this is things that we need to talk about, and say, you know, it's not normal, it's common, but it's not normal, and you could address it.
That was one of the other things I was going to ask you. First off, you froze. Your face is beautiful right now, by the way. Oh. But your screen froze. I don't know if you can.
Oh no!
I don't know if you can click and come back on. I don't know, but you do look gorgeous.
Am I still here?
You are still here. You're just frozen.
Oh no!
But I can still hear you, so that's a plus.
Okay.
Maybe it'll unfreeze in a
Oh,
second.
I hope so.
So that was going to be my next question is, obviously these are conversations that we want to start to open up. How can we talk about, sexual wellness and vaginal health and not incontinence, but pelvic floor health? How do we approach that with our daughters? Like I have one daughter that's going to be 16. I have one daughter that's 27. When should we start talking about it? And what are just the small things we should be saying? Because obviously we don't want to go too crazy yet. But
Yeah, well, I think just my advantage of being a pelvic floor physical therapist, like having my daughter, as soon as she could talk, even before she started formal education, we talked about good touch, bad touch. We talked about our anatomy. This is, it's not the pee-pee, it's the vagina, it's the vulva,
right.
use the appropriate terminology so that when they get older, it's not funny or tee hee hee. They're not embarrassed about it. Even showing, when my daughter was young, we have books, education books to show, and they were just, graphic images, pictures, more like cartoons. Now she's 11 going on 12, she's ready for a little bit more information. And she actually, she heard the term masturbation on TV. She was like, what is that? And I'm like, I know we talked about it, but not in detail. And I think when she heard it, on TV and in real life, then she started getting interested. So
Yeah.
I think part of it is you want to always make sure you're comfortable and you're sharing and that information is available. And I even talk, maybe it's too much information on my end because I talk about a lot of time pooping and peeing and sex. So I think my kids hear it often.
Yeah.
And it's a natural conversation because I've got 2 older boys too, and we have a different conversation with them. But I think as early as you feel comfortable with, because you want to be comfortable with the information too. You don't want to approach your children and be a little bashful or shy because they'll pick up on that as well. But teach yourself, learn, talk to other women, and then feel out your own children too if they're ready for the information. I thought my middle son was ready, and when I presented the information, he ran. He was like, "I don't want to hear that."
Yeah. Okay, well that's good though. But it is so important that we have these conversations. And I think it's so funny that you said using the right vocabulary, because I can't tell you how many times I'll say something like, okay, with, how is your vulva or whatever, talking about things. And so many women don't know the difference between their vagina and their vulva. And I'm like, oh, we need to talk about this. Go ahead. What were you going to say?
Oh, I was going to say, I remember seeing statistics like women, like 50%, 50, 60% can't identify or know the difference between a vagina or vulva, or even their clitoris, or, their labia minora. I mean, there's so many parts down there. If you know your vocabulary, you could share it with your doctor and say, this specifically hurts right here, and it'll be better communicated.
And obviously we take that sex ed class and they show the diagram, but when you're sitting in a classroom full of all these other people, you're not going to be the one that looks like I need to take all this in and be serious about the information. And so it probably needs to be presented a little bit more often. And like you said, why wasn't this something that was discussed, after I had a baby, or even during pregnancy, of things that I should be looking for, or how things feel, or whatever it is. These should be conversations that your doctor asks you. They ask you all the time, other personal questions. How come they don't open up the dialogue of how is your sex life? Do you masturbate? Do you feel comfortable with that? How does it feel when you do certain things?
Yeah. Well, I remember marketing to doctors' offices, and many of them many didn't even realize there was therapy or physical therapy for those issues as well, for pelvic floor disorders. Even simple questions like, they might have like one question on their history form. Are you incontinent? Do you pee on yourself?
Yeah.
And because women think that it's normal, they think, oh, I have to wet myself completely to make it a problem, that they'll just completely gloss over that. So we as women, and even doctors, like healthcare, like more physical therapists should go out and reach out to doctors and say, hey, this is what we do. Because some doctors don't even know. They don't even know how to refer them or where to refer them.
It's very sad. It's like people have pulled sections of the women's health out of the textbooks. I don't understand what happens to it. So, I mean, we could talk about pelvic floor health forever, which it needs to be talked about. But the biggest thing, number one, is understanding that even though it is normal, it doesn't mean it's not treatable. And I think that's a huge thing for women. And it sometimes it is uncomfortable and it's embarrassing maybe to start that dialogue, but it really can make a huge difference in your overall health and your confidence. You know, being able to open up that dialogue with a doctor that you feel comfortable with. And it might be starting with conversations with female members of your family, your girlfriends, and just saying, hey, do you have this issue? Do you see anybody you trust? Would you recommend anybody? You know, how has it helped you? What have you been experiencing? And really sharing these conversations, because I think it's so important that we talk to one another and we're open and honest about it. So you've got a couple resources, and I'm going to share your social media so people can follow you and kind of look at the tips that you are constantly putting out daily and information about pelvic floor health. And then you also have a free guide, correct?
Correct.
What's in your guide?
It's a holistic approach to pelvic floor health.
Okay.
So not looking at the medical side of things, but what are some things that you could do right now as far as lifestyle changes and wellness? So part of that is understanding diet, there's fitness, things that you could do now and address to prepare yourself and build that functional reserve. So even if you're not experiencing any of these pelvic floor issues now, you know, hopefully you could prevent or lower your risk for them in the future.
And also open up the dialogue with your daughters as they start to go through puberty and pregnancy and postnatal. So if I'm not in, because you're in, you're in Florida.
I'm in Florida.
I always want to put you in New York for some reason. You're in Florida. For those of us that are in other states, where's the first place we should look besides talking to maybe some friends for referrals? What are some other avenues I can look for to find something that's, you know, a location, a physical therapist, a doctor's office? What is some verbiage I'm looking for?
There are, I forgot the website. I might have to send it to you, but you could even Google physical therapy, pelvic health locator. And there is a website. You put in your zip code and they'll have a list of providers, physical therapists, nurses, doctors that specifically treat pelvic floor dysfunction.
Right.
So I'll make sure
somebody that's doing shoulder and be like, hey.
Yeah, like they might take a weekend course, but you know, if they don't have the experience or, you know, the confidence, or some will, I felt so bad. I had a friend that I referred to physical therapy, and she went just because she didn't have the right type of insurance. She wasn't accepted, so she had to find another clinic.
Oh yeah.
I said that they did it. You know, they took the weekend course, but they weren't comfortable enough to do an internal examination. So they just gave her everything that you could find on, you know, that you could Google from other clinics. So I was like, you know, there's more that you could do. I'm sorry that you had that experience. So make sure you find someone experienced, and you can ask, you know, do you do an internal examination? Experienced therapists could also, because some women aren't ready for internal examinations. They could do everything externally as well. So be in communication with your therapist, let them know your needs and what you're comfortable with doing, and they'll make the adjustments. So you don't always need internal examination, but you could start somewhere and they could at least give you the right resources and treatments from there.
Okay. No, that's great to know. Some of the things we should be looking for when we're looking for doctors that aren't, you know, don't just look for a physical therapist. Okay, so anything else before we close it out? Like I said, I will share where my audience can find you so that they can get that information from you, and I will share the link to be able to download that guide to kind of give them a holistic approach, someplace where they can get started. Anything else you can tell these?
Well, this was just an interesting fact that I came across. With all these changes that happen muscle-wise and hormonal-wise, the one thing that doesn't change, which is kind of our silver lining, is that the clitoris remains unchanged through all these different bodily changes. So, you know, it's still highly innervated as long as there's no nerve damage. So your happy buttons is still there and functional. So don't think that it's the end of the world with all these other things happening, that you can never have pleasure again or enjoy intercourse or sexual foreplay. So that's there, but you just want to make sure you trust all the other tissue. Yeah, I was like, wow, okay, so everything else is like thinning out and losing flexibility, but the clitoris still does its job.
Well, and that's always good to know that maybe while you're getting treatment for the other stuff, there's always clitoral stimulation.
Mhm.
There we go, ladies. We've got some ways around this right now while it's working. Thank you so much for joining me. I appreciate this. I know we could sit here and talk about this forever. And if you have any questions for me or for Dr. Charlotte, or if you're like, hey, you know what, I would love for you guys to chat a little bit more about topic XYZ, let us know and we will get back together and film that video for you, because we'd love to provide more information to help you live a healthy, active life where you feel comfortable and confident. And whether you are in a relationship or not in a relationship, whether it's by yourself or with somebody else, that you're having an active sex life, because that is important. It doesn't matter how old we are, it is important. So I appreciate your time that you come and spend with us, and we'll be in touch soon. Have a great day, guys.